first year at the Trust, together with our staff, we developed the vision and values which bind us all together. At all times, we strive to be quality-driven, responsible and compassionate. In the past year, we have systematically reviewed all of our governance and quality systems and processes, including our instance and complaints policies. We don't always get everything right, but when things go wrong, it is vital we learn and improve. We are now accelerating our quality journey. There are many ways to drive up quality, but we believe we have identified the 10 things that will make the most difference at pace and have developed our 10-point plan, raising the bar on quality at Pennine, which you will have seen printed out on small leaflets and posters and banners throughout the Trust. It is important that all of our staff does their bit to continually drive up quality. I would encourage everyone to continue to focus on our 10-point quality plan, which sets out the important day-to-day operational quality priorities we can all subscribe to and follow and champion to help raise the bar on quality for our patients and for each other. It is a minimum that our patients who use our services and their families deserve. We need to treat our patients as we would want our family members or friends to be treated. Quality matters, as every member of our staff, whether clinical or non-clinical, commits to playing their part each and every day for each and every patient, and know that our quality journey will be a great success and that we will make a real difference for all our patients.
We're on a journey to improving quality within the Trust. That is something we want to do for our staff and for our patients, and as a consequence of that, we have developed our Raising the Bar on Quality. And we're already seeing massive work being undertaken across all our departments, all our wards, which is seeing that our services are already improving. Quality is important at every level. It's important for our staff to know that they are delivering good care. It makes them feel good about coming into work and being able to do the very best they can, and we should enable them to do that. Most importantly, it's for our patients. It's our commitment to deliver the best possible care in all our environments to ensure that our patients get the best possible experience of health services.
We were the first ward to be chosen at Fairfield, and we've done a lot of really good things actually, and it's been a very positive experience. I think we've decluttered everywhere. We're very good, and I think we're very protective of our own areas, and I think sometimes we're just so busy, as everyone else is, that you just carry on, you're doing the patient care and you forget what's going on around you, and it's good to take a step back and look from a different perspective. So yeah, there was a lot of decluttering, a lot of taking down signs and posters and things that were out of date that sometimes you just walk past every day but you never noticed. We've decorated all the way through, new lighting, new ceiling tiles, any equipment that was broken or needed repairing, we had all that done. And we've relocated some of the areas in the ward to make us compliant with a lot of things, like IV storage, things like that.
The WHO checklist is a good example of how standardising the way we do things in the theatre environment can also help to improve safety by ensuring that the whole team are involved and know exactly what they are doing with reference to each patient who is receiving the treatment. Our way of tackling infection control by standardising how we approach patients in the bare below the elbow setting on the wards and using hand wash in between all patients is another very good example of how we can standardise our operations and help improve safety as well as outcomes. In the last 6 months, we've standardised how we investigate and manage incidents. This has been pivotal in raising the quality of the investigations as well as the learning.
I'm just talking about the colour-coded card system that Infection Prevention have brought into being in the last few months. We're trialling it at the Oldham Hospital and it came about really because of an interaction with one of the consultants on a ward round, and he wasn't really compliant with wearing of personal protective equipment and being bare below the elbows. So he went away and he did read up on our policies. He came back to me, and between us we started doing lots of different things. So we were doing walk-arounds and challenging practice and making sure that staff were not afraid to challenge practice, and particularly with the doctors as well. We're finding that there is a little bit of a hawthorn effect. So when you're on the ward, you only have to give out one card and you find that everybody suddenly complies. But we don't think that's a bad thing, because as long as there is some reaction to the cards and that people, even if it's making them comply for that few minutes, it's making people stop and think. The 10-step quality issues that the Trust is looking at the moment is a really good way forward, and it's a good forward for initiatives like this.
The SNAP data results that were published early this year showed that for the last 6 months, Pennine Stroke Services is an A service, and in matter of fact has scored the highest SNAP results across the country. This is due to the fact that we were able to consolidate and centralise stroke services onto one site, retaining all of our expert trained staff, having monthly multidisciplinary team meetings, and ensuring that we drive the standards of care upwards all the time. This is a great achievement, and it is an example for the rest of services within Pennine to try and aim high, and hopefully we will have many more A stroke services across the Trust.
We're starting to really ramp up with our dementia strategy. We've got a brand new strategy, brand new care plan. We've appointed a dementia nurse consultant, and we're really wanting to enhance services for people living with dementia and their carers. So some of that is about improving communication, getting people to use the This Is Me document, which is really important. Not just filling it out, but reading it, understanding where that person has come from. We're using more in the way of technology to help patients living with dementia who might need distraction or reminiscence therapy. And we're buying in products that will help our staff work with patients in that way. The Oasis unit at Rochdale is an example of what can be done for people living with dementia. We've also got good other wards in the Trust. We've got J5 and we've got at Oldham we have a beautiful dementia garden. We're working with charitable organisations as well in helping to upgrade a lot of the environments. The environment's really important. So as a minimum, we've got about 40 dementia volunteers, and we've just got a network of professional leads for dementia, and they're doing environmental assessments across the Trust.
I just want to tell you about the care and compassion element of this 10-point plan, which is an essential part of the quality plan. Here at Pennine, we're piloting open visiting on a number of wards. Patients have reported increased satisfaction with open visiting and are really pleased to see that their relatives, carers and loved ones can come to support them at times of worry and isolation. Staff have also reported that open visiting has produced less disruption on the ward than anticipated, and are really supportive of open visiting. We aim to roll this out across the Trust in the next few weeks.
We try and adhere to a flexible approach to our visiting at the moment on the stroke units. We encourage our relatives to come in at meal times to assist with feeding. We also have regular meetings with our relatives and patients, with the therapists and nursing staffs, to update with the patient's progress. We also encourage our visitors to come in, our relatives to come in outside of visiting times to help with patient care, especially when the patient's getting ready to go home. Also, if they have travelling problems, we allow them to come in outside of our visiting times as well.
We're looking at all the nursing documentation that goes into the patient's notes. We're looking at it across the whole site, making sure that it's standard, that it underpins practice, it's fit for purpose, and and that we have consistency. If we streamline documentation, they're not going to be repeating, asking patients questions on multiple occasions. We're going to be using one document where 3 have been used in the past. That if they move areas, they will see the same documentation on every ward.
Part of our maternity services at this moment in time, we're going through an improvement plan, and part of that improvement plan is recruitment of support staff. The support staff are really important to support the midwives and the matrons within clinical practice. We have brought in 40 support staff, and bringing that large number of staff into an organisation all at once means that we had to really look at the training we gave them. Part of them took the care certificate, other staff were part of the NHS before. So we have put a 3-day training programme additional to what the Trust already does, so that they can help support the midwives and the women and the families on the maternity unit. This 3 days has been very successful, and they've gone into practice meeting the needs of the women. We've introduced areas such as breastfeeding, which is really important to our families, but our support staff need to be able to support our women and give the correct advice. It's really important when you employ large amounts of staff that we train and develop these staff, because it's really important that as this training takes place, the quality of the service will improve, and this is ongoing.
First impressions are absolutely vitally important for gaining someone's trust and confidence when they first come into hospital. It's an extremely anxious time when someone comes into hospital, whether that's a planned admission or if they come in as an emergency. An open and friendly approach is vitally important in providing that sense of ease and providing somebody with the trust in the care that you're going to provide. The care needs to be compassionate and it needs to be dignified and respectful, and it's vitally important to introduce yourself when you first meet somebody. Here at the Trust we have adopted the national campaign, which is Hello, My Name Is, that was started by Dr. Kate Granger. We've done staff awareness, we've done posters, we've done some training all about this. And little things like staff introducing themselves to each other also at handover care is extremely important. And we need to remember what a trying time and how anxious this time is for patients and relatives when they come into hospital, and making that first relationship and building that relationship just by saying, hello, my name is Lisa.
I think that the Raising the Bar initiative is a fantastic opportunity for staff to combine ideas and to make sure that everybody's working to the same common goal, particularly the communication aspects, where the staff and patients understand exactly what's going on in order to make sure that their treatment plan is conducted in a safe, effective manner.
I think the 10-point quality plan is really important. It is what it says, it's setting the bar, and it's really important that we strive towards that. It also brings some standardisation, some consistency in terms of expectations across the Trust, which is really important if we're going to avoid pockets of good practice here and there. We want the whole Trust to be aspiring to the same level of excellence in care.
Raising the bar on quality has to be the biggest next step for this Trust. It is about really moving us into top quartile within the region, and making sure that we are giving the very best to our patients, but also that our staff are well looked after and proud to work in such a service.